Have you ever questioned something you've done your whole life? Something that once made you feel strong, clean, even proud? But now, it might actually be putting you at risk? My name is Dr. James. And what I'm about to tell you may surprise you, or even change your life. For decades, we've been taught that a daily bath is the gold standard of hygiene. But after 70, the rules change, your body changes, and clinging to old habits could be doing more harm than good. In today's video, I'll walk you through 7 shocking facts about bathing after 70, backed by science. Filled with real-life stories. And most importantly, solutions. You'll learn why your skin becomes more vulnerable, why infections increase, why fatigue lingers longer, and how to care for yourself more safely, more comfortably, and more wisely. I'll also share with you the one simple trick that can help seniors stay clean and healthy, without stepping into a slippery shower. So whether you're over 70, caring for someone who is, or just planning for a better future, stay with me. This might be one of the most important health conversations we ever have. This is Senior Health, and I'm Dr. James. Let's begin. Let's start with the biggest myth of all, that bathing daily is good for your skin. As a doctor who has spent decades researching skin health, I can tell you, after age 70, your skin becomes a completely different organ. It's thinner, drier, more sensitive, and frankly, more defenseless. As we age, our skin undergoes significant physiological changes that compromise its ability to protect, heal, and regulate itself. One of the most prominent changes is a sharp decline in the production of collagen, the protein responsible for giving skin its firmness and resilience. Without sufficient collagen, the skin loses its structure, making it sag, tear easily, and recover slowly. In addition, the sebaceous glands, which produce sebum, your natural moisturizing oil, become less active. This leads to chronic dryness, flakiness, and irritation, especially when exposed to hot water or drying soaps. On top of that, the circulatory system also slows down with age. This means that the skin receives less oxygen and fewer nutrients, which are both vital for healing and regeneration. Combine all these factors with daily exposure to heat, steam, and soap, and what do you get? A fragile outer layer being eroded slowly, day by day. When you combine these age-related changes with daily hot showers and harsh soaps, you're not refreshing your skin, you're stripping it down. Imagine your skin is a protective raincoat. In your youth, that coat was thick and waterproof. But as you age, it becomes a thin paper sheet. And every bath tears it a little more. Every hot shower you take, every time you lather with alkaline soap, you weaken this already compromised barrier. With every wash, you strip away more of the body's remaining defenses. Most seniors don't even realize it's happening. They assume that the dryness, the tightness, and the persistent itching are just normal signs of aging. But in truth, they are often the direct results of overwashing. This is especially concerning because dry, cracked skin is more than just a cosmetic nuisance, it's a medical risk. Skin cracks can serve as entry points for bacteria, fungi, and viruses. Even a microscopic fissure can lead to a serious infection in an elderly patient with a weakened immune system. My patient, Harold, age 78, loved his evening showers, but they became an itch-triggering nightmare. He developed what we call xerosis, painfully cracked skin that bled and became infected, just from washing too often. We had to change his routine. And within weeks, his skin began to heal. Harold's story is one I've seen repeated dozens of times. All of them well-meaning seniors who simply didn't know that their daily bath was undermining their skin's integrity. This is why dermatologists now urge seniors to limit full body baths to once or twice a week, using mild, pH-balanced cleansers, and to moisturize immediately after. This isn't about vanity, it's about protecting your body's largest organ from breaking down. Let me be clear. Overbathing isn't a sign of cleanliness. It's a health risk. It's a common misconception that if we don't shower daily, we're being unhygienic. But hygiene isn't about how frequently you use soap. It's about how well you protect your skin's health and maintain its natural balance. This is why I always offer the following advice to my patients. Use lukewarm water, not hot. Choose gentle cleansers, not harsh, perfumed soaps. Apply fragrance-free moisturizer after every bath. If your skin is cracking or flaking, you're bathing too much. Now, Here's something you might not expect from a doctor. You might be safer from infections if you bathe less. That goes completely against what we were all taught, right? But let me explain, with science and real life. When you're young, your skin heals quickly. A scratch today is gone tomorrow. But once you're over 70, your skin becomes fragile, paper thin, and its ability to recover plummets. Even the tiniest nick from a towel or your own fingernail during scrubbing can turn into tears. Bleeding fissures, or openings for bacteria. That's not fearmongering, that's reality. In fact, the New England Journal of Medicine reported that older adults who bathed less frequently had fewer skin tears and fewer subsequent infections. I once worked with Mrs. Kim, a soft-spoken 83-year-old Korean widow. She bathed daily. It made her feel clean and dignified. But her skin began cracking. One tiny tear near her ankle developed into a staph infection that spread and landed her in the hospital for 10 days. She nearly lost her independence over something as simple as a bath. It broke my heart because it was preventable. Every time you bathe, especially with hot water, you remove sebum, your skin's protective oil, lipid barriers, the fatty layer that locks in moisture, and good bacteria, yes, good bacteria that help regulate your skin's microbiome. When you do that too often, the skin can't heal itself. This opens the door to a variety of conditions. Cellulitis, a painful bacterial infection that spreads rapidly. Eczema flare-ups, which cause intense itching and irritation. Or even sepsis, a life-threatening reaction to infection in rare cases. We must stop equating cleanliness with safety when, in fact, excessive bathing creates the exact opposite. Less doesn't mean dirty. It means strategic. Here's what I recommend to patients. Spot clean daily with a damp cloth in key areas, like the armpits, groin, under breasts, and feet. Use fragrance-free wet wipes for hygiene without damaging the skin. Consider bathing 2 to 3 times per week, or even once, depending on the individual's level of activity and health. For seniors with mobility issues, this approach is especially helpful. It reduces the physical strain of getting into a bathtub or standing in a slippery shower. It's easier, safer, and healthier. If daily bathing leads to torn skin, infection, and exhaustion, then it's not hygiene. It's harm in disguise. The idea isn't to lower standards. It's to adjust the standard to match the biology and vulnerabilities of aging skin. This isn't just a recommendation, it's a paradigm shift. One that allows seniors to maintain dignity, comfort, and health, all at once. And as doctors, caregivers, or family members, it's our job to make that shift happen. Let me ask you a tough question. What's more dangerous to a senior, a little dirt, or a broken hip? If you guessed the hip, you're absolutely right. Because for seniors, a fall in the bathroom doesn't just mean bruises, it can mean the end of independence. It can mean losing the ability to walk without assistance. It can lead to long-term hospitalization, permanent disability, or even death. And here's the reality many people underestimate. Most of these falls are entirely preventable. According to the Centers for Disease Control and Prevention, 1 in 4 adults over age 65 experiences a fall every year. Among those falls, a significant portion occurs in one specific part of the home, the bathroom. It's easy to understand why. The surfaces are slick. Water makes everything slippery. Shower mats shift. Soap builds up. And as vision, balance, and muscle strength decline with age, these risks multiply. Add to that the effects of medications, blood pressure drops, dizziness, delayed reflexes, and you've got a dangerous combination. Now combine that with daily bathing, where a slippery tub, hot water, and awkward movements are part of the routine, and you're looking at the perfect storm. One misstep, one faint moment, one lapse in balance. That's all it takes. I'll never forget Mr. Glenn, an 82-year-old retired teacher. Sharp mind, strong will, lived alone and fiercely independent. But one night, after his usual bath, he slipped on the wet tile floor trying to step out of the tub. He broke his hip, he hit his head, and he wasn't found until the next morning by a neighbor. That fall changed everything. He went from living independently to needing a walker. From living alone to being admitted into an assisted living facility. All because of one fall. One bath. That story still keeps me awake at night. Because I've seen it happen over and over again in my career. And most of the time, it could have been avoided. The decline that follows a serious fall is often underestimated. For an older adult, a fall can lead to a fracture that requires surgery. The surgery leads to bed rest. Bed rest leads to muscle atrophy. Weakened muscles increase the risk of another fall. It becomes a vicious cycle, one that many seniors never recover from. As we age, our bodies lose the physical resilience that once protected us from small accidents. Muscle strength decreases. Balance becomes less reliable. Bones become more brittle. And reflexes slow down. Younger people may stumble in the shower, laugh it off, and walk away without a scratch. But for someone over 70, the same stumble can result in a fractured femur, or a traumatic brain injury, or a spinal injury. Even the simple act of standing up too quickly in a hot, steamy bathroom can cause a sudden drop in blood pressure. This is called orthostatic hypotension. It causes dizziness or lightheadedness, and before you know it, a person has fainted in the shower. Now let's talk about the frequency of exposure to these risks. Think about it logically. If you bathe 7 days a week, that's 7 chances to fall. 7 opportunities for disaster. But if you bathe only 2 times a week, you've immediately reduced that exposure by more than 70%. That's not just smart. That's life-saving math. And before anyone protests, no. This doesn't mean abandoning hygiene. It means changing how we think about cleanliness, changing how we manage risk, and tailoring hygiene to what makes the most sense medically, not culturally. Many seniors bathe every day simply because they always have. They were raised in a generation where cleanliness was equated with social respectability. But that idea doesn't account for the physical risks that increase with age. The habits that served us in youth don't always serve us in later life. So what can be done to maintain hygiene while reducing risk? There are many practical, evidence-based strategies. First, install grab bars in all high-risk areas, inside and outside the bathtub or shower. These provide critical stability during transitions in and out of the bathing area. Next, use a shower chair or bench. Sitting during bathing drastically reduces the chance of slipping. For many seniors, even standing for a few minutes in a wet environment is enough to trigger fatigue and imbalance. A bench provides security and preserves energy. Use non-slip mats on all wet surfaces. This includes inside the tub, outside the shower, and even near the sink where water may drip. Keep the bathroom well lit. Night lights or motion-activated floor lights help prevent disorientation during nighttime bathroom visits. And most importantly, reduce the number of full body baths per week. That's the core message. Bathing less often doesn't mean giving up on hygiene. It means approaching hygiene differently. For example, instead of daily baths, spot clean the body with warm washcloths or disposable wipes. Focus on high sweat areas, underarms, groin, feet, and skin folds. Keep fresh, breathable clothing available and change garments daily. Use deodorant as needed. Prioritize oral hygiene, hand washing, and grooming, all of which contribute to cleanliness and dignity. When I counsel families, I explain it this way. In medicine, we always weigh risks against benefits. We never recommend a treatment that causes more harm than good. So why do we insist on daily showers when they increase risk of injury, infection, and fatigue? A little dirt doesn't break bones, but a wet floor does. Bathing safely should always take precedence over bathing frequently. And for seniors, a safe bathroom is as important as any medication. We now understand that falls in older adults are not just accidents, they're events that often trigger an irreversible decline. Falls account for over 3 million emergency room visits annually in adults over 65. More than 800,000 of those require hospitalization. And among those hospitalized, the 12-month mortality rate after a hip fracture can be as high as 30%. Let that sink in. A fall is not a minor issue. It's a life-altering moment. That's why prevention is paramount. And reducing bath frequency is one of the easiest, most cost-effective ways to lower that risk. Let's be clear. There's no virtue in clinging to a dangerous routine simply because it's familiar. Real strength lies in adaptability, in recognizing when it's time to evolve, and in understanding that sometimes, letting go of an old habit is the most loving thing we can do, for ourselves or those we care for. I've had many elderly patients thank me for giving them permission to bathe less. To let go of the guilt. To stop feeling dirty just because they weren't showering daily. One 89-year-old patient told me, "Dr. James, you gave me my mornings back." He used to spend nearly an hour each day preparing for his bath. Now, he uses that time for stretching, breakfast, or just sitting outside in the sun. And his skin? Much improved. His energy? Better than it had been in months. Sometimes, changing a single habit can restore a sense of control, and that's what matters most. So if you're over 70 or caring for someone who is, it's time to rethink the daily bath. Not just for convenience, not just for skin health, but for safety, independence, and preservation of dignity. Let's also consider the role of fatigue. Fatigue is often overlooked, yet it plays a crucial part in fall risk. When seniors bathe at times when their energy is already depleted, early mornings or late evenings, their muscles are slower to respond. Their coordination drops. And if they're taking medications that cause drowsiness, such as sedatives or blood pressure drugs, the danger intensifies. I remember a patient named Lucille. She was 84, sharp as a tack, but suffered from chronic fatigue. Every morning, she insisted on bathing first thing, a habit from decades past. But one morning, shortly after standing up in the shower, she fainted. She hit her collarbone on the side of the tub. It didn't fracture, but the pain and fear from that incident lingered for months. She started avoiding the bathroom altogether, became less mobile, and eventually lost confidence in doing daily tasks. This is the domino effect of a single fall. First the injury, then the fear, then the isolation, then depression. It's a pattern we see too often. And again, all of it from one moment of overexertion in a slippery space. We have to stop seeing the bathroom as just another room. For seniors, it's a hazard zone, but the good news is, we can do something about it. Occupational therapists are now playing a huge role in fall prevention. They evaluate a senior's home and daily routines and help reduce risk. They often recommend eliminating the need for frequent showers. They help install adaptive equipment, handheld shower heads, chairs, grab bars, ramps, and they teach caregivers how to assist with sponge baths in bed or at a basin. These are not lesser methods. They are medically safer alternatives that preserve dignity without putting lives in danger. In fact, studies now show that older adults who reduce bathing frequency and implement safer bathing methods have fewer emergency room visits, fewer hospital stays, lower healthcare costs, and significantly higher levels of confidence and well-being. But this requires a mindset shift. We must stop viewing daily showers as a sign of self-respect. Respect isn't in the water. It's in the ability to make smart decisions based on where we are in life. For caregivers, this is especially important. You might think you're helping by encouraging your elderly parent to shower every day. But if that parent is unsteady, fatigued, or resistant, you may be putting them at higher risk than you realize. Many seniors won't admit they feel unsafe in the bathroom. They'll smile, nod, and say, "I'm fine," until one day, they're not. So take the initiative. Reassess the routine. Ask your doctor, does my loved one really need to bathe every day? More often than not, the answer will be, no. Bathing once or twice a week, with spot cleaning in between, is enough for most older adults. It's clean enough. It's dignified enough. And most importantly, it's safe enough. Because when you get to 70, 80, or 90 years old, survival isn't about perfection. It's about preservation. It's about preventing the one fall that changes everything. And if adjusting your hygiene habits protects your mobility and independence, why not do it? There is no shame in being cautious. There is no failure in modifying routines. There is only wisdom. And the sooner we adopt that wisdom, the more lives we can protect. I say this not just as a doctor, but as a son who's watched his own mother struggle, who's had to install grab bars in her bathroom, who's sat by her hospital bed after a fall that could have been prevented. This message is personal. It's real. And I hope you take it seriously. It might sound like a bold claim, but your body is far more capable of cleaning itself than most people realize. This isn't a spiritual idea. It's not alternative wellness. It's pure biology. Your skin is not just a protective shell, it is a living, active organ, and it's equipped with an intricate system that maintains balance, health, and cleanliness without needing external intervention every single day. At the heart of this system is the skin microbiome, a complex ecosystem of microorganisms, bacteria, fungi, even microscopic mites, that live on your skin and work to protect it. We often associate bacteria with disease, but many of the microbes on your skin are your allies. They play a vital role in maintaining healthy skin. They regulate inflammation, they fight off harmful invaders, and they even break down sweat and oils to prevent odor. Let me explain. Your skin produces sebum, an oily substance secreted by the sebaceous glands. Sebum moisturizes your skin and forms a barrier against dirt and pathogens. But that's not all. Certain bacteria on your skin feed on that sebum. As they do, they produce natural antimicrobial compounds. These compounds stop harmful bacteria, like Staphylococcus aureus, from colonizing and infecting the skin. It's a symbiotic relationship. You feed them, they protect you. But when you overwash, especially with hot water and strong soap, you destroy this balance. You strip the skin of sebum. You kill off the beneficial microbes. And you disrupt the skin's pH, making it less acidic and more vulnerable to infections. This is why people who bathe too often suffer from chronic dryness, itching, eczema, or unexplained rashes. The skin's natural ecosystem has been thrown into chaos. Think of your skin like a carefully tended garden. Too much water, too much fertilizer, too many pesticides, and the garden dies. But left to find its balance, it flourishes. I had a patient named Margaret. She was 79, very clean, very proper. She showered every day, sometimes twice. Used perfumed soap and antibacterial gel. And yet, she constantly complained of itching, redness, and flaky patches. We ran tests. There was no infection, no allergies. So we tried something radical. I asked her to stop showering daily, to wash only twice a week, to switch to a pH-balanced, fragrance-free cleanser, and to spot clean her body in between. The result? In just 3 weeks, her skin calmed, the redness disappeared, the itching stopped, her skin looked and felt better. And for the first time in years, she wasn't applying medicated creams daily. This isn't magic. It's microbiology. It's respecting the body's own rhythms and design. This natural defense system is especially important for seniors. Because as we age, our oil production decreases, the skin becomes drier, the diversity of the microbiome drops. This makes the skin more vulnerable to disruption. That's why less bathing is often better. It gives the microbiome time to rebuild. It allows natural oils to coat the skin and retain moisture. And it avoids the constant stripping that comes with daily hot water and soap. In fact, studies published in the Journal of Investigative Dermatology confirm this. Seniors who bathe less frequently report fewer episodes of dry skin, eczema, and irritation. They also have better microbial balance. And surprisingly, no significant difference in odor or perceived cleanliness. That's because real cleanliness isn't about how often you scrub. It's about supporting your body's systems to do their job. You don't need to wash your entire body daily. You can simply focus on the key areas: armpits, groin, feet, using a damp cloth or a non-fragranced wipe. This keeps sweat and odor under control. Meanwhile, the rest of your skin remains untouched, able to heal, balance, and protect itself. Of course, there are exceptions. If you have incontinence, if you sweat excessively, if you're dealing with wounds or infections, in those cases, more frequent hygiene may be necessary. But for the majority of seniors, especially those with limited mobility, embracing it gently. More natural rhythm is not only sufficient, it's ideal. There's also a historical truth to this. For centuries, humans lived without daily bathing. They relied on nature, on clean clothes, on fresh air, and on the body's own design. Daily showers are a modern invention, popularized in the 20th century by advertising. Not medical science. There's nothing wrong with wanting to feel fresh. But it's time we separate cultural habits from medical necessity. Especially for seniors whose skin is vulnerable, whose energy is precious, and whose quality of life depends on reducing risks. We have to let go of the idea that a bar of soap is the only path to dignity. Dignity is not in how often you shower. It's in how wisely you care for yourself. It's in knowing your limits and honoring your body's natural intelligence. If you've followed me this far, you may be wondering, what do the real experts say? Are we doctors really suggesting that seniors bathe less? Yes, we are. And not just me. This recommendation comes from a growing number of professionals in dermatology, geriatrics, nursing, and public health. Across the board, leading voices are urging older adults and their caregivers to rethink the idea of daily bathing. Because what once made sense in youth no longer serves us in later years. The American Academy of Dermatology now advises that older adults bathe once or twice a week, depending on their individual needs. The Johns Hopkins Geriatric Center has published similar findings. They emphasize that overbathing leads to skin breakdown, fatigue, and increased fall risk, all of which can reduce quality of life. Even the Journal of the American Medical Association, JAMA, has acknowledged the toll that excessive bathing takes on senior bodies. So this is not speculation. It's not alternative thinking. It is a shift backed by science, backed by decades of research, and by thousands of clinical observations. Let me explain why this matters. Bathing is not just about removing dirt. It's about preserving the skin's structural integrity, protecting natural oils, and maintaining microbial balance. When you bathe too frequently, you disrupt all three. You weaken the skin barrier, you increase water loss from the skin, and you remove friendly bacteria that help protect you from infection. This is why doctors and dermatologists have changed their stance. Not because we want to lower hygiene standards, but because we want to raise health standards. We want seniors to feel empowered, not exhausted, by their routines. We want them to avoid the spiral of skin damage, falls, and infections. And we want to preserve their dignity without demanding energy they no longer have. This change in medical thinking is not universal yet. Many hospitals, care homes, and even families still believe in daily bathing. But that belief is rooted in cultural norms, not evidence. It began in the 20th century. Fueled by advertising, soap companies told us that daily showers made us respectable, that we had to smell like citrus or lavender to be accepted. That real hygiene was measured in frequency, not effectiveness. But those ads never considered the elderly. They didn't factor in aging skin, declining stamina, or fall hazards. So it's time we challenge those assumptions and tailor our hygiene habits to the reality of our biology. I had a patient, George, 75 years old, fit for his age, but recovering from a hip replacement. He told me he was still trying to shower every morning, even though it took him nearly 45 minutes. He was exhausted by the end of it. His skin was cracked and sore. He had slipped once, but caught himself on the sink. He hadn't told his daughter. He was embarrassed. After our conversation, he agreed to bathe just twice a week, to use warm washcloths in between, and to moisturize his skin properly. 2 months later, he told me something that struck me deeply. He said, "I don't feel lazy. I feel free. Free from the pressure. Free from the exhaustion. Free from fear." That's what this shift is really about. Giving seniors the freedom to care for themselves intelligently, not automatically. There is also strong support for this model from professional caregiving organizations. Nursing homes and assisted living facilities are beginning to implement personalized bathing schedules. Instead of requiring every resident to bathe daily, they now assess level of mobility, skin condition, medical history, energy levels, climate, and even personal preferences. This tailored approach is far more respectful and far more sustainable. It honors the diversity of aging, because not all seniors are the same. A 72-year-old marathon runner may need to bathe more frequently than a 92-year-old who's mostly sedentary. A patient with dementia may be frightened by water. Another may suffer from arthritis and need a full hour to get in and out of the tub. Standardization doesn't work in elder care. Customization does. That's why expert recommendations today emphasize flexibility. They don't say, bathe once a week and that's it. They say, find the rhythm that fits your life, your body, and your dignity. As doctors, our goal is not to control our patients. It's to support their autonomy and to prevent unnecessary harm. So here's what I recommend as a baseline. For most seniors, bathe once or twice a week. Use warm, not hot, water. Avoid long showers or baths. Use mild, unscented soap. Moisturize immediately afterward. In between, clean targeted areas, armpits, groin, feet, with a damp cloth or disposable wipe. Use deodorant if needed. Change into clean, breathable clothing daily. And always listen to your body. If your skin feels dry, don't scrub harder. If your energy is low, don't push yourself to shower. There is no gold star for exhaustion. You don't need to suffer to be clean. It's also vital to teach this mindset to caregivers, especially adult children caring for elderly parents. Many of them impose daily showers out of fear. Fear of judgment, fear of odor, fear of neglect. But true care is not about appearances. It's about preserving comfort, safety, and mental peace. And sometimes, that means doing less, not more. Medical professionals are now uniting behind this concept. In conferences, in clinical trials, in long-term care settings, we're seeing positive outcomes. Reduced hospital admissions, improved skin health, less agitation among dementia patients, lower caregiver burnout, and better quality of life overall. So yes, experts do recommend bathing less after 70. Not because hygiene doesn't matter, but because smart hygiene matters more. It's time to let go of shame, to let go of outdated rules, to embrace what science, compassion, and common sense now agree on. That aging well means adapting wisely. And that there is power, not weakness, in slowing down. Bathing might seem like a simple, everyday task, but for many seniors, especially those over 70, it can be one of the most physically exhausting activities of the day. What used to take 10 minutes now takes 45. What once felt refreshing now feels draining. And what should promote health often becomes a source of pain, fatigue, and even fear. This is something that's often misunderstood by younger caregivers. They think, it's just a quick shower. But they don't see what it really demands. Let me walk you through it. First, there's the preparation. Walking to the bathroom, turning on the water, adjusting the temperature, undressing, stepping into a slippery tub or stall, holding balance while water hits your body. All of that requires coordination, stamina, and strength. Then comes the bathing process itself. Standing for several minutes, bending to reach your feet, raising your arms to clean your hair, gripping a washcloth or bar of soap, twisting to rinse your back. These movements sound small, but for seniors with arthritis, osteoporosis, or neuropathy, each one can cause strain or pain. And finally, there's post-bath fatigue, drying off, balancing while toweling feet, getting dressed, brushing hair, cleaning up water or steam in the room. By the time it's all over, the body feels spent. And for many, that exhaustion lasts for hours. I had a patient named Alfred, 82 years old. He used to enjoy morning showers. But as he aged, they started to leave him lightheaded. His blood pressure would drop. He'd feel dizzy, even short of breath. After bathing, he'd have to lie down for almost an hour. Eventually, he stopped going for his morning walks. He skipped breakfast. He became more sedentary. All because he was too tired from his shower. That's when we realized something critical. The shower was costing him more than it was giving him. And this isn't an isolated case. The Journal of the American Medical Association has published data showing that daily bathing is a high-energy expenditure activity for older adults. The warmth of the water dilates blood vessels. This can cause a sudden drop in blood pressure. We call it orthostatic hypotension. It can make people feel faint. It can cause falls. It can even lead to cardiac stress in those with heart conditions. The steam in enclosed bathrooms can also be problematic. For those with chronic obstructive pulmonary disease, COPD, or asthma, breathing in moist air can feel suffocating. It reduces oxygen intake, leads to breathlessness, and creates anxiety. Even healthy seniors often report shortness of breath or a sense of fatigue after a warm shower. And let's not forget muscle fatigue. Nearly 50% of adults over 65 have some form of arthritis. Joint stiffness makes movements like scrubbing, bending, or turning painful. Every action takes effort. And after the bath, many experience residual soreness. This affects their ability to complete other tasks. Instead of preparing a meal, they skip lunch. Instead of going for a walk, they sit down all afternoon. It becomes a cascading effect, fatigue leading to inactivity, and inactivity leading to muscle loss. I once asked a group of seniors in a care home, "What's the most tiring thing you do each week?" You'd expect answers like walking or physical therapy. But no, the number one answer was bathing. Not because they disliked being clean, but because it took so much out of them. They needed help. They needed recovery time. Some were even afraid of how tired they'd feel afterward. This kind of fatigue doesn't just affect the body. It affects the mind. When a task feels overwhelming, people start to avoid it. They delay it. They dread it. And that leads to a new problem: guilt. Seniors feel ashamed for not keeping up with their hygiene. They feel like they're failing. They withdraw. They become less social. All because of a routine that used to feel normal. And the irony? The very thing they feel guilty for avoiding is also the thing that's draining their energy. This is where caregivers need to intervene. To say, you don't have to do this every day. To say, it's okay to rest. Let's do it another way. And that other way can be as simple as switching to twice-a-week bathing, or sponge baths, or seated showers with assistance. These small adjustments preserve energy. And that energy can be used for things that bring joy. Spending time with grandchildren, cooking a favorite meal, taking a short walk outdoors, reading, writing letters, singing in a group, whatever it is. Those things matter more than one more rinse. In fact, studies show that when seniors conserve their energy and avoid fatigue-heavy routines, their mental health improves. They feel more in control, less dependent, more relaxed, and they maintain a sense of dignity that's often lost when basic tasks become burdens. So here's my advice, both as a physician and as a son. If bathing is tiring you out, listen to your body. Scale back, reassess, adapt. You are not being lazy. You are being smart. You are not neglecting yourself. You are caring for yourself in a way that honors your limitations. Because the truth is, hygiene is not a race. And cleanliness isn't a contest. It's a daily negotiation with your energy, your body, and your spirit. And for seniors, especially those living alone or managing chronic illness, that negotiation should always tip toward kindness. To yourself, and to those who love you. We've spent a lifetime believing that cleanliness means a daily shower. But as we grow older, it's time to understand that true hygiene is about balance, not routine. That self-care means adapting, not exhausting yourself. Bathing less doesn't mean giving up. It means protecting your skin. It means reducing fall risk. It means saving your strength for the things that truly matter, your family, your hobbies, your joy. And for caregivers, I hope this gives you permission to be gentle, to choose safety over strictness, to support your loved ones with wisdom, not just habit. If today's video opened your eyes or helped you rethink something, I'd love to hear about it. Drop a comment below. Share your story. What habit are you rethinking? What's one change you'll try this week? And if you believe, like I do, that aging should be graceful, not fearful, please like, share, and subscribe to Senior Health. Together, let's build a community where growing older means growing wiser. I'm Dr. James, and I'll see you in the next video.